Hi, my name is Elise Saunier. I'm a RN and I'm going to be doing an assessment on David, focusing on the peripheral vascular system. So the first thing I'm going to do is I'm going to walk in and I'm going to assess the patient using inspection. I'm going to check both upper extremities for size, shape, and symmetry. I want to make sure that there's no abnormal size difference between the two and it looks like his are both equal. I'm gonna assess for color, and his skin color is equal throughout both of his upper extremities and they're normal for his ethnicity. I'm gonna notice if there's any venous abnormalities, any patterns that aren't normal on his upper extremities, and everything looks normal. I'm gonna start distally using the back sides of my hand and work proximally to feel for temperature on both of his extremities, feeling them bilaterally and their normal temperature on both sides. I'm also going to check for edema, any swelling on the upper extremities. It doesn't look like he has any edema on both sides. I can check for capillary refill on both of his hands, making sure that I have a good blood return within less than 2 seconds, and he does. Next, I am going to check pulses. I'm going to check the lateral aspect of the wrist for his radial pulse. I'm going to use a scale of 0 to 3, 0 being absent, 1 is thready, 2 is a normal pulse, and 3 is bounding, and he has a +2 normal pulse on this radial. I'm going to compare both of them, and he has a +2 on the right side as well. I can also check the medial aspect. His ulnar pulse is a +2, and I would do that bilaterally. Can also check for a brachial pulse on the inner upper arm right here against the humerus, and I have a +2 pulse. I can check for lymph nodes, epitrochlear lymph nodes on the inner elbow, which should not be palpable, and they're not. So nothing abnormal that's noticed. Next, I would move up to the neck. I would check for any visual venous, any JVD, any jugular venous distension, which is not noticed. I can palpate a carotid pulse, and he's got +2 carotid pulses. I'm then going to auscultate and make sure I don't hear any bruit or any abnormal sound which could indicate some blockage. And they both sound regular and +2 bilaterally. Next, I'm going to go to my assessment for the lower extremities. Usually I would have a patient that would be in a gown, and but my patient is just going to pull up his pants and keep his shoes on. So I'm going to start the same. I'm going to do an inspection. I'm going to check for size, shape, and symmetry of the lower extremities. Notice that they're evenly distributed hair. Everything is symmetric that I can see. I'm going to notice for any abnormal lesions or ulcers on his legs that could indicate some arterial insufficiency, and I'm not seeing any of that on either side. I can check, visualize for edema, and I can also press onto his leg and notice that there's no indentation, so no edema. I can have the patient stand up and check for any, type of varicose veins or any thrombophlebitis that are more apparent when the patient is standing up. I will check capillary refill on his toes bilaterally and see that they're less than 2 seconds for capillary refill. I will check temperature as well on both of the bilateral extremities, working my way upward. Then I would check for pulses. I would check the pedal pulse, which is a +2.
Shoes are dirty.
I would check them bilaterally. I can check for the posterior tibial pulse, which is a +2 regular as well. I can have the patient bend his leg at a 45-degree angle and check for a popliteal pulse, which is sometimes not palpable, but he does have a +2 popliteal. Then I would work my way up to the femorals. You could have the patient lay down if necessary. You're okay. I would feel in the bilateral groins, making sure that he has equal 2+ pulses. And then I would auscultate his femoral arteries. And he has good 2+ pulses and no brewing, negative for any arterial insufficiencies. And that concludes my assessment. Thank you.